If you have small intestinal bacterial overgrowth and you've tried a bunch of different motility agents and nothing has really worked, what else is going on? Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor who sees a bunch of different complex things, including small intestinal bacterial overgrowth. So this topic is really a much bigger one than I have time for because TikTok has put me in 3-minute jail again. My videos can only be 3 minutes. So I'm going to talk relatively fast here. There's a difference between true prokinetics, cholinergics, and then laxatives. So the first thing that I would take into consideration is what medications have you tried that are true prokinetics, which include things like prucalopride, what are cholinergics, and what are laxatives. Because there's a lot of different medications along the spectrum, and a lot of the times to be able to really affect small intestinal motility, you have to go with a true prokinetic. And even in this case of things, if your small intestinal motility is repaired, you don't always see like a daily bowel movement if your large intestine motility is less good. But in the treatment of SIBO, that part is it's still important, but it's less important than making sure that things are going through your small intestine. So in terms of the priority of treatment, you want to make sure that your small intestinal motility is set, and then you can worry about the large intestinal motility because that will still cause bloating, but at least you're not getting the small intestinal bacterial overgrowth happening. And the second part of this topic is if you have motility agents, especially if you've been on prucalopride and it works great and then it stops working for some reason, or you've been on low dose erythromycin and it works great and then it stops working, which can be just like a natural thing in low dose erythromycin or other low dose macrolides, that is just a thing that happens. You do get receptor fatigue in those medication dosing schedules. But if that is going on for you, then the next thing that you really want to take a look at is what is going on in the rest of the system, what's going on in like the hormonal front of things, because this is not the only thing, but this is one of the things that I can think of is if your thyroid hormones are off, if you can't convert T4 into T3 appropriately in a way that you're utilizing T3 for motility, then your motility is going to stop. You're going to have other symptoms with this too, but if your thyroid hormones aren't set, that is going to impact your motility in a way that the medications are not going to, they're not going to help you by spot treating. But if you've truly been on like the true prokinetics and the cholinergics and you've basically cycled through a bunch of these medications without it appropriately helping each, if they each have like a limited effect for some amount of time, I would possibly talk with your doctor with a greater cycling type of strategy and see if you can then work on things like working on your microbiome and your inherent gut production of neurotransmitters and their sensitivity to neurotransmitters, because ultimately at the end of the day what we want to have is receptors in your gut that work, that respond to the production of neurotransmitters inside your gut, and that takes some time to be able to build up. So yeah, hope that's helped, and I'm running out of time here, so I got to close this video. But if you have any questions about any specific stuff that I just talked about, drop it in the comments. Thanks. Hope this helped.